Welcome back, friends. We are back with another episode of Diabetic Awareness, and we have Dr. Premnath with us, who will be educating us more and more regarding this subject. Doctor, suppose a person gets diagnosed with diabetes and he is not worried about it and he just ignores it and lets it go. What would be the repercussions?
Um, in the last episode, you learned about the gravity of the situation of diabetes as well as how to make a diagnosis of diabetes. Now, why do we want to treat diabetes very earnestly? Diabetes is notorious for its complications. Now, an acute complication of diabetes is called as diabetic ketoacidosis. Now, in this case, usually type 1 diabetes. What is type 1, you will ask? Type 1 is the diabetes that occurs in young people where they don't have absolutely no insulin at all because of the autoimmune destructions of the beta cells of the pancreas. These people usually go into what is called as diabetic ketoacidosis, where there is a lot of ketone bodies in the blood and they may lose consciousness. They have to be admitted and treated very vigorously, otherwise they may lose their life. This is acute complication of diabetes. Now, when you suffer for a longer time with diabetes, this is what is called as disease duration. If you suffer from say 10 years, 15 years, if you get good control of diabetes, probably all these complications can be postponed. Believe me, never think that you are going to stop all the complications or prevent all the complications. Never it occurs. In diabetes, even with the best possible treatment, you are bound to develop complications in the end because this is a metabolic disease. Now the complications, it occurs from head to foot. I think there is no organ left without complications in diabetes.
You mean to say this is a slow killer? Without our knowledge, it keeps...
No, it gives lot of symptoms. If you ignore, you are gone. See, it starts from, well, let us say, it starts from eye. The eye complications are the first to occur. I will not go into the details of all the complications here. I will give you the names. It starts from eye. In eye, you get what is called as diabetic retinopathy. Now, diabetic retinopathy, when it becomes severe, grade 4, you will get a retinal detachment and blindness. You can get hemorrhage in the eye, either a vitreous hemorrhage or a retinal hemorrhage, then you can lose vision completely, permanently. You can get a premature cataract, of course, which can be treated. Now you come little lower, you have the heart. Diabetes can affect the heart in various ways, but since it is a metabolic disease, it can produce dilatations of the heart and congestive heart failure, and then it can increase the ischemic heart disease. Ischemic heart disease is the term which we use when the heart is affected because of lack of circulation, because of increased blockage in the coronary arteries. So diabetes will increase the incidence of ischemic heart disease. It can also produce what is called as diabetic cardiomyopathy, that is a primary muscle disease. Now you come little lower, you have the kidneys. Diabetic kidneys disease is one of the worst thing to happen. Now once the kidneys are involved, it is a relentless course downhill. Now to begin with, there may not be much problem, but as the serum creatinine goes on increasing, you will have a lot of problems. Now ultimately, you get what is called as end-stage renal disease, ESRD. ESRD is defined as when the eGFR or estimated GFR, glomerular filtration rate, that is the rate with which the blood is filtered, comes down to less than 15 ml per hour, per minute.
Do we get these serum creatine tests done very often, every now and then for diabetic patients?
Yes. In fact, after diagnosis of diabetes, A good diabetologist would always do a serum creatinine, a microalbuminuria, a lipid profile. These three things are very important, extremely important. Because so many people may have these problems in the beginning itself.
How often should we get it done?
See, if the things are normal, once in a year is fine. If the things are abnormal, you have to repeat it often. Microalbuminuria, which is microscopic excretion of albumin in the urine, is one of the most important tests to detect the earliest damage to the kidneys. Yes. Now, once the kidneys are involved, you end up with ESRD and then dialysis. Now, these dialysis could be peritoneal dialysis or a hemodialysis, and you go on having dialysis, or you may have kidney transplantation. Even the transplanted kidney may be affected with
May
diabetes.
not be accepted by the patient.
It is not accepted. It will be accepted because they take all the precautions to see that it is accepted. But the question is, that kidney also will become diabetic in due course. It gets damaged. So therefore, life expectancy comes down very markedly. Then coming down, you have the neurological complications of diabetes. Neurological complications of diabetes could be involvement of the nerves of the legs and hands, bigger nerves. There can be any type of neuropathy. It is called as neuropathy. Involvement of the nerves. So it can start with tingling, numbness, and then burning sensation, severe burning.
In the feet, you mean?
Yeah, which disturbs the sleep. And then they may lose weight, they may lose control of diabetes and all such of things. It is worst, I can tell you. Once if you get neuropathy, you have hell of it. It's the worst complications. And then at the end what happens? You lose all the sensation. Once you lose the sensation, if you get an ulcer, if you get an injury to the feet, you will not know that there is an injury. So it gets infected.
And
It becomes an ulcer.
They also say it takes more time to heal.
Absolutely. If diabetes is not controlled, any wound would take more time to heal, because sugar is a very good media for culture. So bacteria invade very quickly. So a foot ulcer is one of the most costliest complication in diabetes, because you can't go to work, the wound doesn't heal. It will be years sometimes.
They may end up losing the foot or the
fingers. Diabetes is the foremost complication of amputations in the world. Foremost complication. First reason for amputations. Non-traumatic amputations. That is without trauma. Amputation in the world. And then it can affect liver. It can cause fatty liver. And then fatty liver can go into NASH, non-alcoholic steatohepatitis, and then cirrhosis of the liver, and then carcinoma of the liver. So in a nutshell, it can affect any organ in the body and reduce your lifespan and make your life miserable.
And what about the exercise plan?
So diabetics should exercise. There is no doubt about that. If diet is one pillar, exercise is the other pillar.
You mean some aerobic exercises?
See, the simplest of exercise that a diabetic should do is walking.
Okay.
I would say nothing more, nothing less.
Okay.
A good walk. I always say to my patients, 3 kilometers in 35 minutes. 3 kilometers in 35 minutes, or 4 kilometers in 45 minutes, or 5 kilometers in 1 hour. Walk.
Swift walk, you mean? Brisk walk?
Brisk. Whatever the speed that you can.
Okay.
You cannot exert too much. You can walk at your own speed. But try to maintain this time. Cover 3 kilometers in 35 minutes or 4 kilometers in 45 minutes. Wear a good pair of sport shoes. Very important. It should be round in the front, so that your fingers, your toes should not go one over the other and cause ulcers. Your sole should not be very hard. Insole should not be very hard. It can cause a lot of callosities. Corns and callosities. And then it should be proper fitting shoes. Very important. Loose shoes can cause problems. Wear thick cotton socks. Always look at your feet in the night. Do this exercise every day. Earlier we used to say 5 days in a week. 5 days in a week. 30 minutes a day. 5 days in a week. 150 minutes in a week. Now we say for Indians, 7 days in a week. You do this. You walk, nothing more is necessary. But if you want to really do aerobics, do it by all means. If you want to use yoga, do it. This is another form of exercise. Do it. Any sports, please take part in it. After doing sports, you need not have to walk. It's a substitute for walking. Do sports.
Okay.
Fine. You can.
So would
ratio.
some yoga and meditation, would it be helpful?
Meditation will not burn calories. It's okay.
But it
Meditation.
keeps the mind
It
calm.
was psychological health. Yes. Meditation is fine. Yoga definitely is a stretching exercise. Definitely it helps. You must be careful. Adults must be careful
Yeah.
because they can cause problems with their tendons and muscles.
So,
but you can do it.
What lifestyle changes do we make?
No, the question is always obese people are more prone for diabetes. That is very well known.
You
Because
mean weight in the midsection?
Yes. The waist circumference is an indicator of abdominal obesity, and more the abdominal obesity, the more the chances of getting diabetes. We did studies on abdominal obesity also. South Indians have more abdominal obesity. Not having enough of exercise causes deposition of fat in the abdominal portion. And abdominal fat is a very active fat, and it can cause very severe insulin resistance and increase in sugar.
Okay.
So therefore, you have to exercise to reduce abdominal fat. You have to reduce your total body weight. That is very, very important. So there are three things, normal body weight, an abnormal body weight is one is overweight and one is obese. So this is measured by the BMI, body mass index. Now in Indians, we take up to 25, 18.5 is normal. 18.5 to 24.9 is considered as overweight. From anything more than 25, we call it as obese. But in foreign countries, other rules are applied. They take more than 30 as obese. But in Indians, we don't go to that extent. We restrict at 25 itself because complications of diabetes are much more about 25 itself. So you have to reduce weight. You have to have reachable goals. You have to reduce weight. How to reduce weight? That is the $1 million question.
Left to individuals.
Yes, it's left to individuals, but the simplest formula is
Walk.
Eat less, walk more, or work more, whatever it is.
Okay.
So you have to have a negative balance. So your intake of calories should be less, your output of calories must be more. If you create a negative balance, definitely you should lose weight and have a goal which you can reach. 2 kgs in a month is more than enough. 2 kgs in a month over a period of 6 months, 12 kgs you can lose. But afterwards it is always difficult. We know that. But even to reduce weight up to that extent is also difficult. But weight reduction, you have to have absolute control over your tongue, your appetite, what you eat, how much you exercise. These are all individualized. But never go for all these 5 kg weight loss for 5,000 rupees, 10 kg weight loss for 10,000 rupees. All these things doesn't work out. It works out only there. Once you come back, you will gain weight because you will never be able to maintain whatever they have ordered there.
Has been telling us everything about diabetes in a very detailed way, and this was a very detailed discussion. And thank you, doctor, for being on the show.
Thank you.
It was a pleasure having you here, and in spite of his busy schedules, he was very gracious to come here and share his knowledge with all of us. Thank you once again, doctor.
Thank you, Suvarna Keshav, for again I will repeat, for having given me this opportunity to interact with you.
I feel honored.
Thank you.
So friends, this is Suvarna Keshav signing off. Let us all follow all the instructions given by our doctor and let us all stay safe and stay healthy. Thank you. Bye-bye.